Hello, my name is Heather Stefanescu, and this is my presentation on Eric Topol's book, The Patient Will See You Now, The Future of Medicine is in Your Hands. Physicians have largely controlled patients' medical information from the era of Hippocrates to the Code of Ethics of the American Medical Association to the modern guidelines of informed consent. Hippocrates was the father of modern medicine. He adopted the need for physicians to be kind to their patients and to maintain the highest level of integrity in their care. However, he was also the father of modern paternalism, or the belief that physicians are in control of all aspects of a patient's care. This is an example of doctor-centered care, which originated in the 1950s and 60s when the biomedical era was in full swing. It was also the age of the expert, the beginning of physicians focusing on increasing their knowledge base, but losing sight of engaging and fully exploiting diagnosis and treatment options with their patients. However, it can also be seen as a more profound gap in healthcare information. So, for instance, this may be because a physician is trying to protect the patient by not disclosing information that is likely to cause frustration and anxiety. The 1957 revision of the American Medical Association Code of Ethics introduced what we now know as informed consent. This revision required a physician to obtain informed consent prior to conducting a procedure or administering medications. For instance, in the context of informed consent, the doctor understands the complications and risks that may arise from a procedure. But the patient will never have the same level of understanding as a physician. This type of hierarchical authority was challenged during the political and social movements of the late 1960s and 1970s. The people behind these movements advocated for patients to be included in the decision-making process, or what is known as patient-centered care. This called for patients' care to be organized around the patient's goals and values, with patients as active participants in their treatment decisions. In 1994, the Pew Charitable Trust Health Professions Commission and the Fetzger Institute recognized there was a need for physicians and healthcare providers to recognize that the purpose of healthcare is to respond to the needs and concerns of their patients. The process of care should be understood from neither a physician nor a healthcare provider's perspective alone. Instead, it requires an intense focus on the relationship between them, or what is known as relationship-centered care. As we move forward to our modern era, the components and principles of relationship-centered care will include and expand on patient-centered care by integrating the physician's perspective and adding the component of the relationship itself. We are gradually moving away from paternalistic thinking and to one of partnership. In order for this to occur, this will not only require change within healthcare organizations, but also the new technology that is being developed to change it from the outside. A new era of healthcare is beginning to unfold that will make it easier for patients to see their doctors. This is based on a positive psychology theory known as self-determination theory. Self-determination theory identifies 3 factors that make people feel more likely to embrace these new behaviors. The first one is feeling competent or feeling comfortable with the new behavior. Second is autonomy support, which is the idea of being involved in determining when to introduce the new behavior. Third is relatedness, or the feeling of being known, cared about, and supported. For instance, Topol explained that patients will be able to use a smartphone screen connected to the internet to communicate with physicians without having to wait for an appointment at any time, day or night. Patients will be able to take their blood pressure, measure blood glucose levels, and even do an electrocardiogram. This data could be immediately analyzed, stored, and shared with a physician to make a diagnosis that would prevent an emergency room visit. As we move forward to this new approach to medicine, patients will have the ability to use their smartphone screens for secure video consults at any time, day or night, without having to leave the comfort of their own home. By the year 2020, there will be 50 billion devices and objects connected to the internet to allow access to various types of healthcare applications for anyone at any time. Furthermore, technological advances will allow the sharing of data from medical sensors, digital images, and labs well beyond the capability of current healthcare practices. Electronic medical device connectivity is taken even further when considering the Internet of Things. This is the growth of not only people, but also medical devices that will be wirelessly connected to the Internet. Projections are expected to range from 28 to 50 billion connected devices by 2020. The majority of this growth is expected to come from wearable sensors that will track the data. For instance, an average person is projected to have between 6 and 7 connected devices by 2020. Today, smartphones are storing information and data that most people generate in the form of text, emails, social media, pictures, and videos. Topol explained that the two big mobile operating systems, Apple's iOS and Google's Android, are taking this form of idea sharing to an unprecedented level in the field of medicine. Mobile health, or otherwise known as mHealth, is a term used to describe the use of smartphones or other telecommunication technologies that support the delivery of healthcare. Smartphones will be able to transmit a patient's healthcare data, such as personal health records, lab tests, and diagnostic scans directly to them. However, smartphone use is not limited to transferring healthcare data. It is a means of improving the patient experience and limiting frustration for improving the future of medicine. There are three powerful forces that drive this level of excitement for mHealth. One is opportunity to lower healthcare costs. 2 is the rapid growth in wireless connectivity. And 3, the need for more precise and individualized medicine to meet patients' needs. On the other hand, there are also 3 major obstacles to the acceptance and utilization of mobile health technology. The first one is resistance for reimbursement. Second, concern about weakening the patient-physician relationship. And third, it increases workload and the time spent learning the new technology. However, by using change management skills, it allows transitioning individuals, teams, and organizations from a current way of thinking or operating to a future state. For instance, a change agent's role is enable staff to do more, find better ways of operating or doing things, and managing activities surrounding any change within the organizational environment in order to prevent staff frustration, anxiety, or fatigue. Organizations are ensuring that hardware, software, high-end imaging, and technological improvements are transforming the smartphone into a cost-effective device for healthcare consumers. This is an example of human-centered design, which is comprised of several interrelated core values, which are referred to as the Process Improvement Manifesto. Organizations that embrace the core value of human-centered design are capable of quickly adapting to changing requirements, market factors, and building innovation and best practices that help reach new maturity levels. For instance, organizations are creating smartphone attachments containing a lab on a chip, which are changing the way lab tests and advanced diagnostic imaging technologies are used in healthcare. This sets up a point-of-care device that will be able to analyze less than 10 nanoliters of blood, urine, saliva, breath, and even our DNA. It can be utilized for various telemedicine and mobile health-related applications, but it's not limited to diagnostic scans. You can also use it for blood analysis, detection of bacteria or viruses, and diagnosis of infectious diseases. For blood analysis, it includes glucose, cholesterol, kidney function, liver function, and thyroid function. A lab on a chip will also have the capability of detecting strains of the influenza virus, of strep throat, detect heart failure, and even some types of cancer. The future of technology in healthcare forces healthcare organizations to focus on integrating technology with culture rather than focusing on technology alone. It involves relationship-centered administration, or perceiving the organization as a conversation. For instance, conversations between physicians, nurses, administration, healthcare staff, patients, and their families. Within these conversations are sub-conversations. Some may be informal, face-to-face, or even virtual space. We have a new galaxy in the making. There is a time ahead when every human being on the planet has the potential for the same access to medical care, provided they have a smartphone and a mobile signal. Technology drives healthcare more than any other force, and in the future it will continue to develop in many ways. While we can get a glimpse and debate about future trends in healthcare, we need to be clear about how we will align with technology to ensure the best possible outcomes for society as a whole. This concludes my presentation. Thank you very much.